A little bit of anxiety and depression in childhood is normal, obviously. It's part of the human experience. We experience those emotions. For parents to be concerned and aware is when children have prolonged periods of this, where it's not just a normal mood swing, but they seem to stay there. If you then couple this with regression, where they're acting like a couple of years younger than what they typically are, generally those two things together are an indication that there's something going on. If your child is experiencing anxiety or depression, then the important thing to do is to validate their experience. My generation tend to think, oh no, you'll be fine, don't be silly. But when we do that, we invalidate what they're feeling, and it tends to make the anxiety and the depression worse. So regardless of how valid you think it is, when your child tells you they're anxious or depressed, then say, I'm really glad you told me that. I'm sorry you're feeling that way. Then maybe talk to them about some strategies so that they can take some responsibility for helping to fix it. Talk about your parasympathetic nervous system, which helps to deal with anxiety and depression, and how you can engage that. That can be as simple as going for a walk for 20 minutes after dinner. It can be as enjoyable as listening to music or dancing in the lounge. All things which are going to release endorphins, help to engage your parasympathetic nervous system, and help you to manage that anxiety and depression, because that's really going to be the key, how to manage these emotions. If your children feel heard, then that tends to get it out of their head. We often say 80% of the problem is getting it out of their head. You don't even have to fix it, you just have to not let them ruminate. If you're looking for resources in supporting your children with anxiety or depression, I mean, you probably can't go past the Mental Health Foundation in New Zealand, and they've got links to lots of other really good websites. Parents need to think about how they're supporting their own mental health and well-being if they're going to support the mental health and well-being of their children, because, we're their models. If they see us doing it, they'll do it. So carve out some time for some self-care. That can be as simple as having a bath and relaxing with some candles going. Can't really go past exercise. The research is so strong on just what 20 minutes 3 times a week will do, how that will increase the amount of endorphins in your brain and have a huge positive impact on your mental health and well-being. Basically, you need to look after yourself so that your children will look after themselves. Model the good behaviour. And remember to be kind to yourself. Parenting is one of the hardest things you're ever going to do, and it's one of the things you're most invested in because it's, the thing you really want to get right. But the good news is you don't have to be a great parent, you don't even have to be a good parent. The literature literally uses the term good enough parent, so go easy on yourself.